We've been using the CyberKnife system here at University Hospital's Case Medical Center for about the last 3.5 years, and it's been a very positive experience for us.
The CyberKnife's remarkable in that the indications keep growing. You know, we knew we had a unique machine and product that we could use to treat things that we've been treating in the past with conventional accelerators, but now we could treat them with new effort, and those new efforts have allowed us to increase the dose, spare normal tissue, see cure rates that we've never seen before.
The CyberKnife has unlimited degrees of freedom, and so it can reach practically anywhere.
It is, in my opinion, the greatest breakthrough that's happened in radiation oncology since I started.
The nice part about the CyberKnife is that we can treat near major vessels and collecting systems which historically have been difficult to treat with other ablative treatments.
The most remarkable indication for using this tracking system with CyberKnife is watching it track a moving target, such as a target or a primary lung cancer.
By monitoring the motion with respiration, the radiation is not scattered during the treatment process. It stays aimed at the tumor itself and avoids injury to surrounding structure and has the maximum dose of radiation to the neoplastic lesion.
The patients are very comfortable during treatment, so they don't have to do any kind of fancy breath hold techniques. They don't have to be in an immobilization device that's very uncomfortable for them, because these are patients who don't have good lung function.
Lung cancer, it's an ideal platform. Liver cancer, there's now data that's showing that it's probably an ideal platform for curing early stage prostate cancer.
The CyberKnife technology and its ability to track that movement is really what allows us to deliver a more confined dose just to the prostate and deliver a very precise dose to the prostate, minimizing the dose to the surrounding tissues.
As the target moves, the robot will actually build a model and predict where the target will be, so that at any point the beam follows the target.
So instead of putting a 20 millimeter margin around the prostate, we typically put about a 3 millimeter margin around the prostate. So we're radiating less of the bladder, less of the rectum, and we're able to give the radiation much faster in 5 days as opposed to 9 weeks.
There was an example of a patient of ours early on that was almost crippled in pain, and after a few treatments, a person actually was able to get up out of the chair and walk and said, "You gave my life back to me."
We do see a lot of patients from out of state which would require 2 to 3 hours a day on the road if they were to come in for their standard external radiation. So they come for a week and get their treatment, and then they're off.
After the treatments are over, patients can go back to any activities they want, whether they go back to work, go on a vacation, and that's one of the real attractions of the patient is I've had patients having to go to Europe the following week, and they're able to do that after the CyberKnife treatment.
A very common comment that I get from patients is that, are you sure you're actually giving this treatment? That they don't feel anything, treatment's pretty fast, they go home and they just do their daily activities.
CyberKnife has positively impacted our practice in that we do see more patients. I think the major issue is we've been able to help more people. I think that's the goal.
The plan called for conservatively a 2-year payback, and we have actually made that in the first year of operations. Again, the volume exceeded our expectations year one.
We've treated now thousands of patients for all kinds of indications: prostate cancer, brain tumors, spine tumors, lung cancers. It is one of the busiest centers in the world.
Our radiation oncologists and our neurosurgeons have been very excited about having this form of treatment here at Swedish. They have taken leadership roles in the development of new applications of CyberKnife to different sites of cancer.
The CyberKnife has really been a great tool for us to expand our own clinical programs, because it does give us this other aspect of treatment that isn't always available in the community.
I think there's a lot of promise for this type of technology, and I think we're going to continue to see further advancements with this type of technology.